A second healthcare worker has been diagnosed with the deadly disease. The hospital staffer at Texas Health Presbyterian is one of the 76 healthcare workers who provided care for the now deceased Ebola patient, Thomas Duncan. According to the hospital, the staffer was immediately isolated after an initial report of a fever Tuesday. The CDC says they've interviewed the patient to identify any contacts or potential exposures in the community.
Our nurses are not protected. They're not prepared to handle Ebola.
Another infection on the heels of shocking new allegations from unnamed nurses at the hospital who say there were no protocols to deal with Duncan.
On his return visit to the hospital, Mr. Duncan was left for several hours, not in isolation, in an area where other patients were present.
All this released by National Nurses Union. The union wouldn't say how many nurses came forward, nor would they identify them. The nurses say protective gear they wore left their necks exposed.
Has raised questions and concerns about the fact that the skin on their neck was exposed. They were told to use medical tape wound around their neck that is not impermeable.
The hospital did not address the allegations directly, but in a statement said, patient and employee safety is our greatest priority, and we take compliance very seriously.
We're not sure how she was infected, but we're not waiting for the results of our investigation. We're immediately changing any procedure that we think can be improved to increase the safety of those caring for her.
But an official close to the situation tells CNN that in hindsight, Duncan should have been transferred to Emory or Nebraska, hospitals that are more than ready to treat Ebola. Remarkably, Pham, the first person to contract Ebola within the U.S., says she's doing well and feels blessed to be cared for by the best team of doctors and nurses in the world.
I know for a fact Nina is somebody who never shies away from safety. We have an entire department on infection prevention and infection control in the hospital. We're briefed almost monthly on infection control.